Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How do you inject, administer Zepbound? Zepbound is administered once a week by subcutaneous, under the skin, injection. Your healthcare provider will show you how to do this, and then you can administer the injection at home yourself or have a caregiver administer it for you. Your healthcare provider will tell you the correct dose of Zepbound to use. Zepbound is a single-dose prefilled pen. It can be injected into the skin on your stomach, abdomen, or your thigh. Another person can give you your injection into the back of your upper arm. How do you use the Zepbound pen? Take your pen out of the refrigerator. It is not necessary to leave it for 15 minutes to warm up to room temperature. Keep the gray base cap on until you're ready to inject. Verify the pen label to ensure it's the correct medicine and dosage, and it's not expired. Examine the pen for any damage and check the expiry date. The liquid inside the pen should be colorless to slightly yellow and free of particles. Wash your hands. Choose your injection site, such as the skin on your stomach, but not within 1 inch of your belly button, or your upper thigh. Another person can give you your injection in the back of your upper arm. Rotate your injection site weekly, even if you use the same body area. Make sure the pen is in the locked position, pull off the gray base cap, and throw it away. Do not put it back on. Do not touch the needle. Place the clear base of the pen flat against your skin at the area you wish to inject into, stomach, thigh, or upper back of the arm. Unlock the pen by turning the lock ring. Press in the purple injection button at the top of the pen and hold for 10 seconds. You should hear a first click which tells you the injection has started and a second click that tells you the injection has finished. You will know your injection is complete when the gray plunger is visible. Throw your used pen away in an FDA-approved sharps container. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of a heavy-duty plastic. Can be closed with a tight-fitting, puncture-resistant lid, without sharps being able to come out. Upright and stable during use. Leak-resistant. Properly labeled to warn of hazardous waste inside the container. If you have questions or problems with your Zepbound pen, visit www.zepbound.com, contact Lily at 1-800-LILY-RX, 1-800-545-5979, or call your healthcare provider. Related questions: how do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? Tirzepatide versus semaglutide, how do they compare? 7 Mounjaro side effects you need to be aware of. How do you store Zepbound? Store your pen in the refrigerator between 36F to 46F, 2C to 8C, until you are ready to use it. Keep it in the original carton to protect it from light. If you take your pen out of the refrigerator, you can store it at room temperature, up to 86F, 30C, for up to 21 days. If you take your pen out of the refrigerator, do not put it back in there again. Discard the pen if not used within 21 days after removing it from the refrigerator. Do not freeze your pen. If the pen has been frozen, throw the pen away and use a new pen. What happens if I drop the pen? The pen contains fragile glass components. Handle it with care. If the pen falls on a solid surface, do not continue to use it. Replace it with a new pen for your injection. What strengths is Zepbound available in? Zepbound is available in 6 different strengths: 2.5 mg/half a milliliter single dose pen, 5 mg/half a milliliter single dose pen, 7.5 mg/half a milliliter single dose pen, 10 mg/half a milliliter single dose pen, 12.5 mg/half a milliliter single dose pen, 15 mg/half a milliliter single dose pen. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.